Hey everyone, this is PA Clark again, and today's topic is misconceptions on aesthetic injectables. So what are some of the biggest misconceptions? Now these misconceptions has been ongoing for over a decade. From the first introduction of botulinum toxin, Botox, around 2003, there's always been a paranoia around Botox. Right? So Botox is a trigger word and it instills fear in individuals who know nothing about it, but it also instills confidence and the ability to control your aging for others who understand and who have experience with this product. So let's look at some of the misconceptions that are still lingering today. First is going to be, there's always results where an unnatural appearance occurs, or a frozen face. You are only frozen if your medical provider makes you frozen. That's one thing to understand. You are only frozen if your medical provider makes you frozen. So I have many patients who come, and some of them, hey, I want to be frozen. Hey doc, I need to be frozen. I want to be frozen. I don't want anything to move, not even my eyebrows. I don't want to move. That's perfect. I can do that and still make you look natural. There are others who may say, well, I don't want it to be frozen. I just don't want lines, which there is a balance there. But I can also do that and make you look as natural. So if you ever see an individual that looks unnatural, or they look frozen, remember, it's not the product that caused that. It's not the Botox or the Dysport or the Xeamine or the Jeuveau or the Daxxify. Yes, there are 5 different botulinum toxins on the market today. It's not those products, it's the provider who makes you look frozen. Sometimes now we want a nice smooth forehead. Remember, with a smooth forehead, it's going to be shiny. If you do not like oily skin, then maybe don't overdo the treatment on the forehead, because once you cannot move, you will have a more glistening effect on that forehead, which I think is beautiful. By the way, who doesn't want a smooth, shiny forehead? Another misconception is, well, am I going to become addicted to this product? The answer to that is no. If you have an addictive personality, you'll become addicted to anything that you like. If you don't have an addictive personality, you don't have anything to fear. But the number one thing that stops people from overindulging is the cost. There is a cost with this treatment. So it's hard to overindulge when you're spending $1,000, $2,000, and $3,000 at any given time. The second part to that equation is, if you have a medical provider that doesn't want to tell you stop or no, then of course you're going to indulge and indulge and indulge. So the problem with having too much work done, or individuals that may have too much work done, is twofold. It's the provider, the medical provider, and it's the patient. And that combination, if those two individuals, one that's greedy and another one that's over enthusiastic about a perfect look, that combination will always create disasters. Let's look at another misconception. I like to call these miscons. So miscon 2, these injections are only for older individuals who want to reverse the signs of aging. This is so true. But which 28-year-old doesn't want to also reverse the visual signs of aging? Everyone wants to reverse the visual signs of aging. So this is a huge misconception. At 60 years old, you may say, well, I like the way my face looks, but I just want my eyebrows higher, or I just want fuller cheeks, or I've never had a jawline. I want to see how I look with a jawline, or I've never had a full chin. My chin has always been small. I want to have a more pronounced chin. So that tells you that these treatments are not just for aging or the older individual. It's really for anyone who wants control of the way they look. It's for anyone who wants to be part of the design of their external features and how they want to look. Miscon 3. Aesthetic treatments make my face look unnatural. Now this harkens back to the Miscon 1 where it says that these treatments can make you look frozen. The reality is, again, if there's a negative result, if anyone ever looks abnormal, unnatural, overdone, it's not the product, it's the person they went to. Think of your hair salon. You line up 10 hairstylists, and out of 10 hairstylists, you're probably only going to like one of them because they really connect with what you see as beautiful for you. And that's the same in this industry. This is an art form. So one medical provider doesn't necessarily know how to do everything for everyone on this earth. You have to find the medical provider that's right for you, that understands what you mean by beauty, understands your culture, understands your skin, understand what you are looking to portray. And then you likely will have an amazing relationship with that medical provider. Miscon 4. Dermal fillers will leave my face saggier over time. Now, I hear this all the time. Hey, Clark, am I going to look older when this wears away, making me have to do it over and over? Now, the reality is these products slow down the aging process and sometimes halts the aging process temporarily. Therefore, when the product wears away, you're not seeing yourself necessarily older. You're seeing yourself from the point that you began 1 year ago or 2 years ago. And sometimes for others, that's frightening because it can happen really fast. Therefore, these products do not create sagging. On that note, if these treatments are overdone, meaning you're stretching the skin beyond its limit, especially the lips or the cheeks, then you can have sagginess in the skin. Why is that? Well, let's imagine a balloon, right? A water balloon. You take a water balloon, you fill it with water, and it expands out. Now, if you expand that to its maximum capacity and leave it there for 1 year, when you deflate that water balloon, what are you going to have? You're going to have a loosey-goosey, rubber-filled entity. That's what happens to the face. So be careful when you are jumping into the trains of huge Russian lips and just large features that don't necessarily work with a natural appearance. Sometimes we are damaging the skin if it's overdone. And again, it goes right back to your medical provider. One thing is a trend that you can see on television. There's some shows. What's the name of one of the shows that we've had? I'll ask my crew. The show, one of the...
Is it a doctor show? Or?
No, it's one of the Beverly Hills Moms or...
Oh, the Housewives.
Housewives. And there's one where there's a very common character, right? With huge lips and just overdone faces. You all know what I'm talking about. I don't necessarily watch TV as often, so forgive me if I don't know the names of the characters or of these cast members. But yes, they can pull that off because they require you to watch them. And if they have nothing interesting for you to watch, you will not watch them. However, you cannot walk around in public looking like them. You see, so that's the difference. They're working. In reality TV, it's not reality. So it's a misnomer. However, those actors are working. Huge lips, overdone faces, that's there to capture your attention. That's not there for you to come on board, create a face, and walk around like that. So they're working, but you're not. So remember, reality TV is not reality. Don't put it on your face. Now, Miscon 5. Aesthetic treatments are painful with a long downtime. But this is not really the case. And I'm going to sound like a broken record, but most negative experiences that you encounter with aesthetic injectables are related to the person or the medical provider injecting you. So this is true. Now, if your Botox treatment have a downtime of longer than 5-10 minutes, it's the injector. If your filler treatment have a longer downtime than 24 to 48 hours, it's your injector. Most of these treatments are so graceful and gentle that you should not experience a very long downtime. This is what we're going to discuss in one of my episodes labeled Discounted Disaster Aesthetic Treatments. You get what you pay for. So if you're paying way below market for your beauty treatments, do not expect expert service or expert results. Now, with the dermal fillers and the downtime, we have to be very careful. Sometimes downtime can be increased by what you do after the treatment. For example, one of my regimens is to apply no pressure to the face after the treatments. And this has to do with no sleeping on the face, but also no ice. And the reason for that is when you apply ice, you are applying a tremendous amount of pressure to the injected region. And no one applies ice for 5 minutes. You apply ice 20 minutes, 30 minutes, sometimes an hour you're sitting there with the ice on your face. Increased pressure on treatments lead to negative results and negative experiences. So if your provider tells you to apply ice, ask them why. Now you must follow what your provider is advising you, but try to get a detailed explanation as to why they require ice. And if the reason is to reduce so much swelling or bruising that you're going to have, then it's the technique that occurred that's giving you this bad result. So one of my hopes is that a few years from now, every injector is giving you such graceful results that you don't have to think about pain or downtime. Miscon 6. Aesthetic treatments are dangerous and harmful. Well, if anyone says this, they clearly don't know what they're talking about. Aesthetic treatments are not dangerous. They are not harmful. These are medical procedures. These medical procedures have been ongoing for almost, if not more than 2 decades, whether it's the US or outside of the US. If there's any danger, the public should definitely know about these dangers. I have been doing Botox on my face since I was 35 or a little older. I've been doing dermal fillers. I do it very natural, so I don't indulge in too much filler or too much Botox on my face. I just keep things natural. If you are not doing that, you will have some problems. Overindulging of anything in this world will always lead to problems, and one of those are dermal fillers and Botox, cosmetic treatments. So are they harmful? No, they're not. There are many more harmful things in this world that hurts you much more than what Botox can ever do for you. Most of the harm that occurs from Botox or dermal fillers does not come from the product. It comes from inexperienced injectors who are using techniques that are not necessarily the best for you. However, this has been changing over the past decade since most of the pharmaceutical companies are employing a lot of dermal aesthetic trainings for medical providers. So always make sure that your medical provider is up to date on their training, which will relieve you from some of the negative experiences that you have been or that you may encounter. That's it for this episode on misconceptions. Now there's so many more misconceptions that I am willing to debunk, but I need your questions. I need to know what is on the pulse of your thoughts, what you need to know to understand so you can have a pleasant, graceful, good experience with Botox and dermal fillers. Click where you need to click to subscribe, and we will get back to all of your questions.